and thank you for joining us today for this embargoed briefing to update you on CDC's COVID-19 response. We are joined today by CDC Director Dr. Robert Redfield and CDC's COVID-19 Incident Manager Dr. Jay Butler. Dr. Redfield and Dr. Butler will discuss CDC's updates on who is at higher risk for severe illness due to COVID-19. At this time, I'd like to turn the call over to Dr. Redfield.
Thank you, Ben, and thank you all for joining us today. I want to remind you about how to protect yourself, your family, and your community in advance of the 4th of July holiday. While the past few weeks saw cases begin to trend downwards, there are a number of states across the United States, particularly in the southeast and southwest, that are seeing increases. Evidence tells us that these increases are driven by many factors, including outbreaks in settings that are particularly challenges, as well as increased testing and community transmission as well. In addition, in some instances, the hospitalizations are going up as people seek care for non-COVID related health issues as well as COVID-19. We continue to work to get information we need to understand the complexities of this disease and share that with the public. We can't lose sight of the fact that this pandemic is caused by a new virus. It was totally unknown to us just a year ago, and we will continue to refine guidelines on how we can best reduce the risk of infection based on data and science. For those at higher risk, we recommend limiting contacts with others as much as possible, or restricting contacts to a small number of people who are willing to take measures to reduce the risk of becoming infected. In other words, when you must go out into the community, being in contact with few people is better than many, shorter periods are better than longer, and contact at greater distance, ideally at least 6 feet, are better than closer. Everyone can take these steps to protect themselves, their family, and their communities, but they are particularly important for people who are at higher risk and for people who live with and care for individuals at higher risk. In summary, the keys to COVID prevention remain: number 1, social distancing; number 2, frequent hand washing and hand hygiene; number 3, staying away from others if you're ill; and number 4, properly wearing a face covering when you're unable to social distance. I want to share with you some other important news. After gathering and thoroughly reviewing the most current evidence, CDC is updating its information that we're providing about people who are at the higher risk of severe outcomes from COVID-19. First, we want to be clear about what we think puts people at higher risk for severe disease, hospitalization, intensive care, and even death. We know that the risk is a continuum. It's not just the risk of those ages 65 and older. And based on what we've learned, we now understand that as you get older, your risk for severe disease, hospitalization, and death increases. We also updated the list of underlying health conditions that can put you at higher risk for severe disease, hospitalization, and death based on the latest review of scientific evidence to date. A key point is that we want to make sure that people know that as your numbers of underlying medical conditions increase, your risk of severe illness from COVID also increases. I'd like to turn it over now to Dr. Jay Butler, our COVID-19 Incident Manager, to provide further discussion on these issues. Thank you.
Hey, thank you, Dr. Redfield, and it's good to be able to speak with you again. Let me provide a bit more detail about the update to the underlying medical conditions that increase one's risk for a severe outcome due to COVID-19. First, as Dr. Redfield mentioned, we know that the risk of severe illness from COVID-19 increases progressively with increasing age. Or to put it another way, there's not an exact cutoff of age at which people should or should not be concerned. Second, we want to reiterate and update information about which underlying health conditions put people at higher risk. Part of the reason why risk increases with age is because as people get older, they are more likely to have other health issues. that may place them at higher risk. We reviewed the evidence related to each of these conditions and determined whether there was strong, mixed, or limited evidence whether they were associated with increased risk of more severe illness, which may be measured by hospitalization, ICU admission, or death. The underlying conditions for which there is the strongest evidence of higher risk are cardiovascular disease, chronic kidney disease, chronic obstructive pulmonary disease such as emphysema, obesity, that is a body mass index of more than 30, any immunosuppressing condition or treatment, sickle cell disease, history of organ transplant, and type 2 diabetes. We also clarified a list of conditions that might increase the risk of severe illness. Some of these conditions include other chronic lung diseases, such as moderate to severe asthma and cystic fibrosis, high blood pressure, a weakened immune system, as may occur among persons after blood or bone marrow transplant, immune deficiency, poorly controlled HIV infection, or use of other immune-weakening medicines. Another is neurologic conditions such as dementia or history of stroke, liver disease, and pregnancy. Let me say a bit more about that last one. Today we'll be publishing an MMWR that compares data on pregnant and non-pregnant women with laboratory-confirmed COVID-19. Based on analysis of these surveillance data, pregnant women with COVID-19 were more likely to be admitted to the ICU and also to receive mechanical ventilation than were non-pregnant women. Based on the data available now, it does not appear that pregnant women are at higher risk of death from COVID-19. We are collecting additional information, and we're working to find out if COVID-19 is associated with pregnancy complications. As always, we're sharing these updates and others as we learn more so that you can have the best, most current science-based information to help all of us make decisions about how to protect ourselves, our families, and our communities. We want to live as safely as we can and minimize the risk of COVID-19 while it is circulating. As Dr. Redfield mentioned earlier, each person has to make decisions about what level of risk they're comfortable with as we go about our daily lives. CDC is committed to providing science-based information about how everyone can reduce the risk.